Okay, dear students, now we will learn about the blood supply of the heart. You know that blood supply consists arterial supply and venous drainage. Okay, the heart is supplied by coronary arteries. There are two coronary arteries, and the coronary arteries arises from the ascending aorta. There is the ascending aorta, and the origin point of the coronary arteries are known as the coronary sinus. Okay, I will talk this to you in later. Now I will tell about the features of coronary arteries. Okay, coronary arteries get blood supply from the during diastole. Okay, we know that when systole occurs, the blood is supplied to the whole body, but coronary artery receives blood during the diastole. This is a peculiar feature. Okay, then the diameter of the coronary arteries is about 1.5 to 5.2 millimeter. Okay, left coronary artery. There are two coronary arteries, right and left. The left coronary artery larger in its caliber and gives supply to the more myocardium. Okay, then the coronary arteries are functional end artery. This is a feature of coronary artery. They are functional end artery. Actually, end arteries are those arteries that have no precapillary anastomosis. But in this case, in heart, there is precapillary anastomosis. But when insufficiency of one branch occurs, then another one by this precapillary anastomosis cannot compensate. Okay, that's why they are anatomically they are not end arteries, but because they are connected to each other by precapillary anastomosis, but functionally they cannot compensate each other. That's why they are functional end arteries. Okay, then the origin of these arteries from the coronary sinus. Okay, now come to the points. The features of the coronary arteries. They are functional end artery, I have told you, and during the sympathetic stimulation, the branches to the myocardium are dilated, but the supply to the epicardium they constrict. This is also a peculiar feature. And now the coronary arteries. There are two coronary arteries, right and left. The right one arises from the anterior aortic sinus. This is the dilated portion of the ascending aorta. Anteriorly there is a sinus. This is the anterior aortic sinus from where the right coronary artery arises. This is the ascending aorta, and right coronary artery arises from the anterior aortic sinus. Okay, then the course of the right coronary artery, after its origin, it goes through the right part of the anterior part of atrioventricular group and encroaches towards the posterior part of the atrioventricular group, and it terminates by anastomosis with the circumflex branch of left coronary artery and by giving the posterior interventricular branch. Okay, this is the course of the right coronary artery. Then the branches of the right coronary artery. After its origin, it gives a branch to the infundibulum. This branch encircles around the pulmonary trunk. It is known as the right conus artery. Okay, then it gives some atrial branches and some ventricular branches. The ventricular branches are divided into anterior ventricular branches and posterior ventricular branches. Okay, then atrial branches. The atrial branches anterior, lateral and posterior. Okay, the main branches are the right marginal artery. It accompanies the inferior border up to the apex, and the terminal posterior interventricular artery. Okay, now I will talk about a special thing, that is the coronary dominance. In case of posterior interventricular artery, it is determined. Actually, we tell this side is dominant, which artery gives the posterior interventricular artery. If right coronary artery gives the posterior interventricular artery, it is right coronary dominance, and if the left coronary artery gives the posterior interventricular artery, it is the left coronary dominance. Okay, now the area of distribution of the right coronary artery, it supplies the right atrium, the right ventricle, except the adjoining part to the anterior interventricular group, which is supplied by the anterior interventricular branch of left coronary artery. This part is supplied by the anterior interventricular group. Otherwise, the whole of the right ventricle is supplied by the right coronary artery, and the right coronary artery also supplies the left ventricle, adjoining part to the posterior interventricular group. Okay. Now, and the junctional tissues. The junctional tissues of the heart mainly supplied by the right coronary artery. The SA node is supplied by right coronary artery in 60% cases, but in case of other 40% cases, the SA node is supplied by the left coronary artery, and the other junctional tissue, other part of the junctional tissue is supplied by the right coronary artery, except the left bundle branch of bundle of His, left branch of the bundle of His, it is supplied by the left coronary artery. You have to know it. It is very important. The blood supply of the junctional tissue of the heart. All of the junctional tissue is supplied by the right coronary artery, except a part of left branch of the bundle of His. It is supplied by the left coronary artery. And in case of SA node, there is a variation that is 60% by cases. In 60% cases, it is supplied by the right coronary artery, and other 40% cases it is supplied by the left coronary artery. Okay, now the left coronary artery. Left coronary artery arises from the left posterior aortic sinus. This is the posterior aspect of the ascending aorta. There's two aortic sinus, right posterior aortic sinus and the left posterior aortic sinus. Okay, now the left coronary artery arises from the left posterior aortic sinus. After its origin, it comes in the left part of the anterior part of the atrioventricular group. Okay, between the left auricle and the left ventricle, it comes in the atrioventricular group and gives up the anterior interventricular branch, and then it continues as the circumflex branch of left coronary artery. Okay, which then process towards the posterior part of the atrioventricular group and terminates by anastomosing with the right coronary artery at the crux of the heart. Okay, this is the course of the left coronary artery, and the branches of the left coronary artery is the left conus artery, which encircle around the pulmonary trunk, and the anterior interventricular group, anterior interventricular branch. It is also from the left coronary artery, and the circumflex coronary artery, it gives the left ventricular branches and gives the atrial branches also. The atrial branches also have divided into anterior, lateral and posterior group or posterior branches. Okay, this is the area of distribution of the right and left coronary artery. Now, if you are asked by a ventricle, that is, tell the blood supply of the right ventricle or tell the blood supply of the left ventricle. Now you will tell, it is easy to you now because you have learned about the branches and area of distribution of the coronary arteries. The right coronary artery is supplied by the Right ventricle is supplied by the right coronary artery, except the adjoining part to the anterior interventricular group. This part is supplied by the left coronary artery. Okay, it also supplies the left ventricular artery, part of left ventricular artery that is adjoining to the posterior interventricular group. Okay, the blood supply of the left ventricle, it is supplied by the left coronary artery, except the adjoining part to the posterior interventricular group, which is supplied by the right coronary artery. Okay, now the venous drainage of the heart. Venous drainage of the heart by mostly by the coronary sinus and its tributaries. Okay, now the tributaries of the coronary sinus, it consists the great cardiac vein. That is, this great cardiac vein lies in the anterior interventricular group and continues to the posterior part of the atrioventricular group and drains into the coronary sinus. Here is the coronary sinus. It is the largest vein and about 3 cm in length, and it lies in the posterior left part of the posterior part of atrioventricular group. Here is the coronary sinus. Okay, this coronary sinus ultimately drains into the right atrium. Okay, now the great cardiac vein drains into the coronary sinus. Then there is left marginal vein drains into the coronary sinus, and in the posterior interventricular group there is medial cardiac vein. Okay, and in the right part of the posterior atrioventricular group there is a small cardiac vein. This small cardiac vein continues from the right marginal vein that accompanies the right marginal artery of the right coronary artery in the inferior border. Okay, the right marginal vein continues as a small cardiac vein and ultimately drains into the coronary sinus. Okay, then there is also some veins from the left atrium, just like this, and is known as the oblique vein of the left atrium. These veins drain into the coronary sinus, and some other veins that arises from the right ventricle, they are known as anterior cardiac vein. These are 3 or 4 straight veins lies parallel to each other and ultimately directly open into the right atrium. And the chambers of the heart itself has venous drainage, and these veins are very small and the smallest vein actually of the heart, and they drain directly into the chambers. Okay, each chamber has their vena cordis minimi, the smallest vein, and they directly enter into the chamber. They are valvulous and also known as the Thebesian veins. This is the venous drainage of the heart. Okay, now the blood supply of the heart, nerve supply of the heart. Okay, nerve supply of the heart gets autonomic nerve supply, and there are sympathetic and parasympathetic nerve supply. The parasympathetic nerve supply comes from the vagus nerve, and it is cardio-inhibitory. When parasympathetic stimulation occurs, the heart rate decreases, and when the sympathetic stimulation occurs, the heart rate increases. It is cardio-acceleratory, and also it dilates the coronary arteries. These are all things about the artery supply and nerve supply. Thank you.